Thank you, Reed. So Data Across Sectors for Health is actually funded generously by the Robert Wood Johnson Foundation, but it's not actually part of the Robert Wood Johnson Foundation. If you want to go to the next slide, it's actually a collaboration mainly by the Illinois Public Health Institute in partnership with the Michigan Public Health Institute. And we have been in existence for about 70 years at this point and are in our third phase of grant making and learning communities where we're working with communities to build local data sharing capacity. The idea originally started as part of the focus that Robert Wood Johnson had around this idea of efforts to improve health in communities across healthcare, public health, and community-based services. But I think that what we've seen through the discussions that we've had today is this is really moving far beyond that as we look at how communities are needing to collect information and share information, and how they're identifying what are issues that are important to them to solve, or what we like to call use cases, but that some of these use cases transcend local and regional needs and actually occur at the national level as well. Next slide. So our model is really built around this idea of having local initiatives that focus on these three elements on the left-hand side of the slide: data and information sharing, multi-sector partnerships, and collaborative efforts. And the idea is really to improve the capacity of communities, right? It's not to, what we have done is learn from communities what works and what doesn't work and what's important to them and what are barriers as sometimes imposed by policy or by partners who maybe have greater power, be they state or healthcare, that don't allow the communities to identify and develop relationships where they can share information to address their needs. So if we want to go to the next slide, I'll show you, kind of walk you through how this strategy works. The idea is when we work with communities, and we've worked with over 500 communities across the country at this point, is to really, again, build that local capacity. And while we're doing that, we are sharing what we have learned in other communities with them, and we're learning from those communities to build that evidence base. You see on the lower right-hand side of the left side of the intersection of that Venn diagram. But ultimately, the goal is to build a movement, right? Not just change one little community at a time, but to build that evidence base so we're sharing information on how information sharing actually occurs in communities so other communities can learn, and we can have, on the right-hand side, you can see system change, right? That eventually this it comes up to the higher levels of state and federal policy, and we develop best practices that are codified and made useful in state and federal policy. Next slide. And this is, how does this manifest at the local level? I think that we've heard several accounts at this point of how, Sandra Hernandez was describing, and we heard from the Robert Johnson Commission recommendations. Increasingly, we're focused on the importance of developing trust and shared governance to promote equity. But when we look at a community from social determinants of health lens, yes, health we traditionally have associated with public health or clinical healthcare. In some expanded communities, even behavioral health has been included traditionally. But the truth is that in these communities where people are living, the issues that affect their health most are actually from housing and education, public safety, and justice involved systems. social and human services and economic development. And those are, informations that have been historically kind of siloed from each other. And even when we're talking about governmental agencies, those agencies may be siloed within their own administrations from other government agencies. So they're not even sharing information amongst themselves. But in the dead center there, what we see is that the community residents, and that voice is ultimately what informs a thriving multi-sector community data ecosystem. We cannot get to equity if we don't have the community voice included. Next slide. So what have we done? Since its outset at DASH, we've worked with over 500 different communities. Starting on the left-hand side of the slide there, you'll see what we called our OG or original grantees were 10 large communities that we funded significantly for a good amount of time, up to 24 months, to learn from communities that had kind of begun to do some of this work. Some of those communities have speakers represented today, and you'll hear from the work that they've done. And we took those learnings and we developed additional new funding models that we went back out into the community with our community impact contracts. And those were about 50 different community contracts to help multi-sector collaborations catalyze their efforts to share and use data to improve health equity and build a culture of health in their communities. From there, we again learned, we innovated, and we saw there was more communities that wanted to learn, how do I begin to do this? So we took the folks that we had funded previously who had kind of successfully worked through these processes, and we created a mentorship program where those well-established kind of community collaboration communities were mentoring early onset communities that were trying to begin the work of figuring out how do we talk about things like shared governance, and how do we identify a use case. So that program is in fact still running in several cases. And then again, we learned, we innovated, and we looked at what was what was coming out of the Cures Act. How is the money that was coming into these communities being spent, and how is this decision making being made on how those communities actually would use that money for public health or community health, and whose voice and who was represented at those tables where those decisions were being made? Just state actors, or were there community-based organizations and community members there? People.
Waldo, you got about another minute left.
Great, thank you. So we have been running the LAP, or our Learning Action and Policy Partnerships program, and we're in our second cohort of that. And then, as was mentioned earlier, we developed a program that we're running now with the ABC Institute at DePaul University on helping communities identify assets within their own communities to uplift where they have strengths. Next slide. And part of that peer learning that we've been describing, we also kind of took up to the national level with other organizations. You could see our current partners at the bottom there. We developed the all-in online community, as well as the partnership network, and that provides the opportunity and platform for different communities and organizations to kind of see this work in action across the country. Last slide. Thank you very much. There's my contact information. If anybody has any questions or would like additional information, I can be reached there.